The first ever joint annual health review has commenced in Abuja with a strong focus on repositioning Nigeria's healthcare system. The event also served as a platform for the release of 3 pivotal reports: the State of Health Report, the Public Perception Survey, and the Health Vulnerability and Adaptation Report. Here's more on this report.
The federal government increased budget for health and social welfare in 2024 underscores its commitment to making healthcare more affordable and accessible. In line with this, the government has prioritized workforce development, aiming to retrain over 120 frontline health workers to ensure the delivery of quality care. At the Joint Annual Health Review, the Coordinating Minister of Health and Social Welfare, Mohammed Ali Prati, highlighted initiatives such as the Maternal and Newborn Mortality Reduction Investment Initiative, aimed at addressing high maternal mortality rates in targeting high-burden areas.
In response to the unacceptably high maternal mortality, we've identified the 174 local governments all over Nigeria that accounts for 50% of maternal deaths in Nigeria. And we developed the Maternal and Newborn Mortality Reduction Investment Initiative. The rate of stunting is also another area, malnutrition. We've seen an uptick and we need to double down on those areas. And in response to these numbers, it is not just about the numbers. There are people, there are families, there are children, there are women, there are poor persons and people being pushed into poverty because of that. So it's not about the statistics, but that there are people and families and communities affected, and we respect that. And we will double our efforts in response to those findings in line with the President's agenda.
The chairman of Senate Committee on Health, Senator Ipaliwo Harry Banigo, reiterated the National Assembly's commitment to strengthening health policies and increasing domestic budget allocations, particularly for vulnerable populations.
For us in the National Assembly, we want to say that we are quite excited about this accountability framework, because this is accountability at all levels for everybody: stakeholders, governments, politicians, community people. Is accountability. And I'm happy that there's going to be a revised accountability framework. That tells us that in the next budget, more funds should be allocated for VGF and used appropriately. And we are very pleased in the Joint Health Committee in the National Assembly on your push for the revitalization and strengthening of primary health centers. Because we know primary health care is still the cornerstone of our health services. And we need to make sure that funds that are engaged there are utilized, are seen to be utilized, and get the gains and the outcomes that we are looking to.
In his keynote address, Senator Hope Uzodinma, representing the Nigerian Governors Forum, encouraged greater collaboration in achieving shared health objectives.
We have seen worsening trends in neonatal mortality and malnutrition. These statistics highlight the urgency of our work and make the signing of the Health Renewal Compact timely and crucial. We must continue to work together, recognizing the unique challenges each state faces, while maintaining our shared focus on achieving better health outcomes for all Nigerians. I would also like to commend the Federal Ministry of Health for its continued effort to translate the compact into action.
The newly launched Health Vulnerability and Adaptation Report addresses the impact of climate change on health, emphasizing the need for climate-resilient strategies to protect against environmental challenges.